Hello and welcome to Professor Speaks. Today we're going to be talking about drugs and are they making you more depressed? But before we get into that, I would like to remind you to hit subscribe and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And today we're going to be talking about the thought behind drugs making people more depressed. Now, in the LA Times, I believe it was Wednesday, they published an article from a paper coming from the Journal of the American Medical Association. Thank you. The LA Times was talking about a paper that was published there where a study was done where they were trying to see if there was a correlation between the amount of people getting more than 3 prescriptions or 3 or more prescriptions and whether that was making them more depressed, right?
Well, it's a little bit more involved than that.
I just give them the broad.
It's well known that there are drugs that have that they produce feelings of depression.
Right.
It's also well known that if you take several drugs, that there's potentially a further problem.
Uh-huh.
What this study did was to do a survey of 26,000 people or so, and to give them also a depression test, a depression scale, a PHQ-9,
Okay.
in order to identify whether they were depressed based on the therapy that they were getting.
So
okay,
just for
that's
the people at home, PHQ-9 is a way that
it's a way to test whether someone is depressed or not.
So it's more than just like how they do with the pain scale where they say how depressed are you?
Yes.
It's a little more involved in that.
A little more involved in that.
Is that more scientific or is that more?
It's more scientific. It's used in research studies, but it's not what's known as pathognomonic. It's not that if you have a rating on PHQ-9 that therefore you're depressed. They deal with it based on symptoms in this particular case.
Okay.
But they're looking to find out whether people have any symptoms of depression, like they're having trouble with sleeping, they're having trouble with performing their activities of daily living. They may have difficulty in going outside. They may have difficulty in feeling just down and unhappy, or they may even, in the worst scenario, be thinking about suicide.
Right. So that kind of brings out the scale, and they judge it based on that.
Yes.
Okay, that's interesting. That's interesting stuff. Because when you do we talk about opiates before, right? When we talk about opiates and we do that in regards to pain, it's mostly subjective. The doctor has to go based on what the patient says.
Right.
So in this case, the PHQ-9, you could do it more based on just whether or not that person is feeling this way. I mean, it seems you want to get a more scientific view of it. Is there signs and say when you take blood or things like that?
Well, number one is depression in general is not one where you go to the lab and you take blood and it gives you a test and it says you're depressed or not depressed.
Right.
Not that kind of a thing. More often than not, doctors will look at it, they will look for particular symptomatology, and they will say that this person seems to be depressed. Okay? The PHQ-9 is another way of looking at it to try and give something more substantive, as you say, more scientific. But neither one says absolutely you weren't depressed, now you are depressed, and what to do about it. They're trying to deal with something that is not like a blood pressure or a diabetes that you take blood, you have a number, the number's too high, and therefore you have the problem.
Right.
It's not like that. It's trying to deal with symptoms.
Right. So the reason why I was going that route was because when you're trying to prescribe to a patient a set amount of drugs, and it doesn't even have to be for depression, it could be for whatever. How do you avoid that patient becoming depressed?
Okay. There's 2 things going on here.
Right.
One is the study that was done where they did this survey. They did a survey and they associated the volume of drugs that people were on. In this particular case, they were on at least 3 drugs that had in their package insert that they could cause depression.
Okay.
Not causation. They didn't say why. They just said there's an association here. We need to be careful because there's a lot of studies today that have some sort of association, but they're not giving the real causation. And you can have all kinds of associations that in general are crazy. They don't mean anything. In this particular case, it's more well known because those drugs already have well established, they're in the package insert that they can cause depression. Well, what did they find? They found that a significant number of those people, over 40% of them, effectively had potential signs of depression if they were on 3 or more of these drugs. Okay. Now, what do we know about that? We know that one, drugs can cause depression, and there's a whole long list of all of these drugs. So you look at that and you think, oh, this is crazy. How am I going to deal with all of these drugs? Well, the issue in general is that there are certain chemicals in the brain, and if you modify those chemicals, then you can get a stimulant or a depressive kind of disorder, something that makes you happy or makes you depressed. In general, if you change something with regard to those particular chemicals, then there's a chance. So, for example, dopamine is one of those chemicals in the brain that is frequently related to depression. So if you have a drug that can modify the level of dopamine in the brain, then therefore there is a chance that you could get depression. Now, what are we talking about? 100%? No, not even close. What was found, at least in the survey, was that if people were taking 3 or more, they had a 15% chance of having depression.
That doesn't
versus,
seem too high.
It doesn't seem too high, but you're looking at maybe 1 out of every 7 people that are taking 3 or more of these drugs.
No, when you say it like that.
Yeah, when I say it like that, it sounds a little different, doesn't it?
Exactly.
And the placebo was that maybe 5%. So if people weren't on the drugs at all, they could still have a problem where they could have depression just by nature of the drugs they were on. And that was about 5%. And if they were on 3 or more of these drugs, it was about 15%. And it brought up another issue. And the other issue is something we call polypharmacy. And that is, if you're on a few drugs in general, you don't get into a lot of problems, depending on what the drugs are. But the more drugs you take, then the more chances you are of having a drug-induced problem, a drug-induced disease.
Right.
If you're elderly, it's very common. People are on 5 or more medications. So there's a greater chance from polypharmacy of too many drugs causing a problem. This particular case, they've already identified that 3 or more of these drugs can begin to cause a problem. And if you add a certain drug for a muscle relaxant or a drug that is used for a neuropathic pain, nerve pain in diabetes, it can make it even bigger. It could make it 60%. So you'd be looking at it potentially 1 out of every 2 or more. So the idea is take a lot of the drugs that have this problem, you are a greater risk for having the problem. Add some further drugs to it can make it even worse. That's what's going on. This has been known a long time, but these kind of studies and association are trying to reconfirm for us that there are problems and people need to be aware.
So in a way, the study is kind of bringing all the issues that society is bringing up today, meaning more people with depression, more people in general, more population, more of a sick population, and more people going to the hospital trying to get more drugs, right?
Yes.
So in a way, they're trying to figure out whether it's scientific or whether it's psychological.
Which is part of the issue that it's an association, not causation.
Right.
But the larger issue here is to, one, look at the profile of the patient to see if they meet the profile that would make them more amenable to having depression. Namely, are they already depressed?
Right.
Then this potentially could make them more depressed. If they're not depressed at all, but they're on several of these drugs, 3 or more, then there's a chance that they're going to have it, that they're going to have a depressive symptom, and add to it. And because many of these drugs are very common, like proton pump inhibitors or drugs like Prilosec or Nexium, those kind of drugs are very common. They're over the counter, so people could be taking them. You can see it. And as a result of that, very common drug also H2 antagonists, drugs like Pepcid or Zantac or Tagamet. These are common drugs. You can get them over the counter. And so the issue is that many of these drugs, whether they're used for blood pressure, whether they're used for mood disorders, whether they're used for common other kinds of problems that you deal with, the issue is that more of the drugs is potentially a problem and people need to talk to a pharmacist or a doctor. And secondly, if you begin to have the problem, then you need to report it right away, because this is something that can be managed by stopping the drug or decreasing the dose or otherwise, depending on what's going on.
Right. So as a provider, or even as a patient at home, what can they do to avoid these kind of problems other than just, I feel something is going on, I feel more down? Is that a reason to go to your doctor, or is there something else they can do?
Well, number one is kind of common symptoms of depression, which may not be, oh, I've got a major depression, but certainly some things like I'm having trouble sleeping, I'm feeling I don't have a lot of anxiety, I do have a lot of anxiety, and I'm feeling just kind of down.
Right.
I have trouble getting up to go off and go to work or do the activities of daily living. Things like that tend to make you think that there's potentially a problem, that it needs to be reevaluated.
Yeah, I seen an article about that the other day where most of the people in our population, they feel like depression has to deal with sadness only. And that's not the case, right? It's not
no,
the case.
Everybody feels sad sometimes for whatever reason, whether it's a family issue or something that's happened or something you've read or something you've heard on TV or radio or otherwise.
Right.
Everybody feels sad. This is something where somebody is feeling sad on a very regular basis, and it goes from the spectrum of I'm having trouble sleeping and I'm feeling kind of down, all the way to the fact that I either am sleeping all the time or I can't sleep at all. And number two is that someone starts to think about suicide, with the major problem of many people have said, oh my God, I'll kill myself if I have this kind of thing, which is really just talking.
Nobody's saying that anymore.
Yeah, nobody's saying that. But it's an issue of, if you have a plan.
Sorry.
If you have a plan, then immediately that is something you need to be reporting and people need to be jumping on, because in general, if people have that problem and a plan, then that is serious and needs to be addressed. On the other side, there's this whole spectrum of problems. All this is doing is saying, and it's not minimal, we're not minimizing this at all.
Right.
But what we're saying is that medications can add to the problem. And the more of them that you're on will be there. In order to help people, I'm asking Em to put a list of what I did at the bottom of this, where I just took a bunch of the drugs and put them into categories so that people could see. But it's based on the fact that there are certain chemicals in the brain. There's serotonin, there's dopamine, there's acetylcholine, there's hormones. People take hormone replacement, estrogen replacement. In women, they take birth control pills, etc. These are all drugs that can add to it. Individually, maybe nothing. But when you add them all up together, then maybe something.
Right.
And that's where we're talking about it. And I'll have him do it so people can look at it and see, because the real concern is polypharmacy, taking a lot of drugs, in this case 3 or more, and dealing with the fact that each one of them already has a well-recognized, well-established, that it can cause it, but we're not talking about that it happens to 100% of the people. It doesn't happen to 50% of the people. It doesn't happen to 25% of the people. But as I said to you, when you take a lot of it, this could be something that you need to address, and it may be a drug-related problem, so you now have a reason that you can to fix it.
Right. And a lot of our focus today on this talk was prescription medication, but it's not only limited to prescription medication. Recreational drugs are now being approved as legal now, like marijuana.
Yes.
So what role would recreational drugs play in this as well?
Well, recreational drugs, people who are already depressed, these are already indications in the profile that a person can be depressed.
Right.
So you add to the fact that there's all these drugs that deal with the brain chemicals. You add to it potentially that they're on recreational drugs and or that they're depressed, and it makes it even more. For example, you're taking these people that have 3 or more and they have about a 15% chance. You add a drug that deals with nerve pain in diabetes or a problem with regard to a muscle relaxant, it increases it to over 60%. You add recreational drugs, etc., you're pushing 60% or more. So it's not like it may not be every patient, but you're now looking at more than 50% of the people, 1 out of every 2 could have that problem. So all it's not all, I don't mean that. What I mean is that it's taking the profile of people and making it a bigger number that people have to be aware of.
Right. Right. So, of course, with all cases, you have to talk to your doctor about this,
or ask the pharmacist about the drugs that you're on, so that they can give you information about is this a drug that has potentially that kind of a problem.
And feel free to open up about your recreational use too, because that's also important for a pharmacist to know in regards to them getting a prescription and taking recreational drugs on the side. I mean, this is important, and it is for your own health and safety. And
just to add, confidentiality is important. Pharmacists, doctors, nurses are all bound by confidentiality when they're talking to someone about their medical problem. So it's not like someone's going to go out and start announcing about some information. You're talking to them about a medical problem. It's confidential. It's not for them to be saying. It's your story. If you want to expose it, that's up to you. But in that regard, you're talking to them and trying to get objective information from them.
Right. So now, in your circle of trust, make sure you put doctors, pharmacists, and nurse. Correct?
Yes.
All right. That's all we have for you today. Thank you very much, Dr. Stern. And if you have any comments or messages, please feel free to leave them below. And we would like you to visit the ProPharmaConsultants.com website. There's a free information page called RxInfoX. And we will have a new video for you every Friday. And make sure when you watch this video, hit subscribe and hit the little bell for notifications.